And we are back after the break. We got some new avatars on display as well. And our keynote speaker is in the room. Welcome, Gabriella.
Welcome to everyone. Thank you for inviting me.
It's such a pleasure to welcome you today as the Human Factors Certified European Ergonomics Human Factors Researcher, President of the Institute for Sustainable Society Innovation, and many other fascinating activities and achievements that I don't want to take time away from your talk, because this could this could eat up a lot of time going through your fabulous CV. So without further delay, I would like to give you the floor, and I'll stop sharing so that you can take over the presentation, Gabriella.
Yeah, thank you. Thank you very much again. And good morning, everyone. I'm very happy to give this talk because this is a topic I love very much, but I think that this is a topic of a huge interest for the professional and scientific community of ergonomy. So that's why I suggested this topic, and unfortunately, this is also a topic that we can recognize in our everyday life from news and everyday disasters that continues to happen in Europe. So I will try to share my screen. Can you see it properly? Okay,
yes.
Great. So again, let's have a look, let's say a quick glance on how ergonomics may contribute in a variety of aspects of modality to improve the way in which European communities, European societies relate with risk, and will become more and more able to cope with the negative effect of the risks. Here we have, let's say, one of the most iconic landscape view. This is the Vesuvius. I'm talking to you from Naples, exactly from the tall building, just in front of the Vesuvius. We visit Pompeii, a great Roman city totally destroyed by a volcanic eruption. We know that this is a very active and living volcano. So why we love this view? We visit Vesuvio. We are not afraid by these mates we have in our everyday life. Is this million of people totally crazy or waiting for total destruction of their cities? The point is that human beings have a very strange, or may have a very surprising relation with risk and safety. And this is a great challenge when we want to plan, design, arrange things in order to ensure public safety in case of disasters. Leaving the jokes apart, let's see what European Commission as a general institution, very much focused on safety and security of their citizens, talks and says things about resilient society. The point is that disasters have a great cost, a huge cost in terms of social well-being, on safety and health of individuals, economical costs. So European Commission has set a series of goals to increase disaster resilience of our society. If we look at the goals, we will find a lot of words we are very familiar with. We see improving risk assessments, we see disaster risk management and planning. We read about preparedness of the population. we read about enhancing early warning and enhancing mechanism response capacity. And then we see ensuring a robust civil protection. Many of these words are words that we use in our everyday life as ergonomic professionals, ergonomic scientists. And we see that we have, let's say, a cloud word about ergonomics, we may say mirrored in the disaster resilience goals by the European Commission. So we can consider that we have a sort of call to contribute with our knowledge, with our expertise, with our techniques to the improvement of disaster resilience of European society. Why we may be so crucial, and I would say this topic is worthy to be widely addressed by the ergonomics society. Because when we talk about disasters, we talk about physical settings, physical environment, which cannot be totally known in advance. So we will talk about, and we need to design procedures and to act and to apply procedures in an environment which is highly uncertain and changeable over the time, in a very short and fast time. We talk about societal resilience. So we should focus on individual citizens or on subgroups of social actors. And within the society, we find a very high variability of culture, sociocultural background, knowledge, education, physical and cognitive capabilities, cultural characteristics, also related to risks and safety attitudes. This is crucial if we want to apply the universal, let's say, and equality approach of European Union to citizenship. Also, we talk about a context where we have a very limited opportunity if compared to the usual field of application of ergonomics linked to industry or anyway industrialized, institutionalized environments, because we need to standardize training, regulate rules, understand responsibility and accountability, but this should be applied to private citizens, or at least we should aim to set up positive attitudes and positive behaviors under this perspective. Of course, even if we think at the largest industrial company, we will have a limited number of individuals, we will have the well-defined recruitment process, training process, and this cannot be reflected as it is to the whole society. So we have challenges in making citizens and making all public authorities able to cooperate and to properly behave in a disaster context. And also, this is linked to the fact that we have a lot of levels of interactions among private citizens, civil society, and public institutions. There are mixing geographical scales and geographical extensions, applicable rules, regulations, laws. Also, knowledge, roles, responsibilities are distributed, scattered, I would say, among many institutions and many roles. And to make things even more complex, every time we talk about public safety and disaster risk society, risk resilience society, we talk about transversal risks, cascading effect, and also risk specific. So the knowledge and the preparedness, let's say, may vary a lot across all the European regions, cities, and communities. Who are the human actors in disaster resilient society landscape? If we want to focus, to put people at the center, as ergonomics we must, we need to consider that we have at least 3 macro categories. We have citizens, and with citizens we have the huge variety of citizens within social groups and within individuals. Then we have local and national institutions which have the role to, let's say, observe and steer the action on local context. And then in case of a disaster happens, or in case we need to be prepared to design procedures, be prepared for disasters and procedures and practice, of course, we need to refer to first and second responders. So civil protection, fire brigades, volunteers, healthcare actors, and so on. All these actors have their own beliefs. They are able, or they access specific technologies. They have to cope with constraints of resource. We have their own social capitals, specific knowledge, and to be effective in implementing disaster resilient society practices, we must foster as much as possible the exchange of information and knowledge among these groups and among the specific actors of this group. We need to ensure that everyone can access and properly use tools and equipment needed or supposed to be used in case of crisis. We need to ensure that everyone, as individual and as group, behave keeping in mind and having as a scope their personal and safety of people nearby. We need then to set up more flexible, efficient actions and cooperation before, during, and after a disaster can happen. Going to practical examples, we see that the field of application of ergonomics and also the field of expertise, specific expertise of ergonomics that can be of crucial usefulness in this context are very, very many. I would say every type of specialization of ergonomics, any type of expertise in ergonomics can bring a benefit in this context. We have topics such as situational awareness in first responders and in citizens. We have a very complex organizational chain and also very changeable collaborative decision-making process, because we need to act at strategic and tactical level according to the evolution of the events. We have a lot of emerging technologies trying to bring benefits in the disaster prevention and management. And all these implies new challenges, implies the assurance of proper user experience by end users, usability. We have also physical interaction with technologies. We see small robots, but also we see exoskeleton that we may use to relieve a little bit the workload, the physical workload of first responders. Then we have citizens. When we design, we need any type of system, whether it is a physical building, a physical system, or it is a technological system. We need to keep in mind that we have as target the whole society. So inclusive design, design for all are key concepts, key approach for this type of context. And this applies to any type of system. This means designing effective and inclusive evacuation system, evacuation routes. We need to design and to be prepared to offer temporary shelter suitable to anyone, suitable to any type of mental or physical specific special needs. We need to design early warning systems and to build risk knowledge awareness, reaching as much as possible any individual of our society, because only all together, we may, let's say, overcome the huge extent of the disaster impact. And then we have also other very popular, I would say, and common topics in ergonomics, because during an event, we need to cope with fatigue and workload management. And this will affect not only first responders, but also citizens affected by disaster. We need to be able to give to anyone equal opportunity to be safe and equal opportunity to recover, because not only during the disaster we have more or less vulnerable citizens, but especially after the disaster, in the short aftermath of the disaster, we see how much vulnerability creates inequalities in consequences of a disaster. If we bring this, let's say, ergonomics expertise to the lens of disaster resilient society, we can see that the United Nations Office for Disaster Risk Reduction depicts a five-step cycle for disaster risk management. We have, of course, the disaster, but before and after, we have preparedness, we have response, we have rehabilitation and recovery steps, and then we have prevention and mitigation. In each of these steps, we may find a particular challenge for human factors, because we will have in every step human system complex interaction, because each of the human factors, human actors I mentioned before, is a crucial actors to be involved in every step. Then we have variability and interaction among individuals and specific social groups, which must be enabled in doing their best, let's say, in all of these steps. And this brings a very large, let's say, comprehensive ergonomics challenges involving all the aspects of ergonomics, because we saw physical, cognitive, and organizational aspects, all relevant and all interacting, all brought together to get the expected benefit of increasing our disaster resilience for the society. If we want to have a little bit closer look to these steps, we can see that if we look at preparedness, we have for citizens the challenge of being informed about the risks they are exposed to, but also being able to assess how this risk is relevant in a given moment. So they must be able to understand warning messages, and then to be trained to apply proper procedures and proper behavior in case of warning messages alerting about an incoming event. Then we have other aspects, for instance, concerning preparedness, and this is linked to the capability to have staff stockpiled for survival in a couple of days, for instance. So how to have access to energy, have to have access to enough storage of water, drugs for our everyday, to keep at minimum of our everyday basic needs in case of a disaster happens. But we have also totally different aspects relevant, which involves human factors and safety culture, because we have the, let's say, the social-cultural aspects linked to the risk preparedness and disaster preparedness, relevant in terms of trust we have and we can build in public institutions, and also the awareness on the side of public institutions of the impact of bias and culture in the interpretation of risk messages, warning messages, and willingness to properly apply direction and instructions given through institutional authorities in order to make everyone able to cope in the best way in case of a disaster. From what concerns public institutions, and then we may have both first responders and local and regional, national authorities, we see that we must support, we must assist these authorities, these are public actors, in, let's say, design risk communication and information packages which are suitable for everyone, so that can reach everyone and can be effective for everyone, taking into account human and social variability. Then we can assist those actors in learning from past events, analyzing under the human factors, dynamics, and human and ergonomics lens what happens in the past, what were the mechanisms, positive and negative mechanisms that were implemented for the management of a specific event. We must create, we can support these institutions in create mechanisms to foster the exchange of information among the roles, among institutions. So this information exchange shall happen transversally and longitudinally, let's say, among institutions. Then we must be aware that every citizen or any social group may have different specific needs in case of disaster. So all public institutions must be involved in processes which consider human variability when they design first response procedures, when they assess, estimate the impact of an event, trying to consider not general citizens as ideal citizens they refer to, but eliciting all the relevant characteristics, personal or social characteristics, which may become a source of vulnerability in case of an event. And then the planning activities shall consider the inequal impact of a disaster. So also in designing recovery measures of first response measures, we must encourage public institutions and first responders in addressing in a different way specific needs because people may be affected in an uneven way from a disaster. Then we have the disaster itself. And in this case, what we must ensure, thanks to the contribution of ergonomics and human factor science, we can ensure that everyone is able to receive and understand early warnings, and also to be updated along the disaster evolution with the direction that can be given by institutions. But of course, we must also ensure that directions are feasible, can be followed by everyone. So we must be realistic, and realism in direction comes from the knowledge of human variability. Also, citizens must be able to estimate if the behavior they are going to put in practice is safe for them, safer for themselves, is safe for people surrounding them. It's also safe for the first responders, because one of the most common consequences of improper behaviors by citizens is that first responders are put at a higher risk to complete the rescue mission, for instance. Then we must consider in communication information the impact of biased culture. So people could not trust an information, could overlook a suggestion, hints at a specific mandatory direction just because they don't consider realistic the consequence that the direction wants to avoid. And we know the role of social media. There is the key point that citizens must be responsible in sharing information, avoiding the spreading of misinformation or just false information, and able to understand if an information they find in social media is trustable and then is worthy to be shared. From the other side, we have public institutions and we have practitioners, and they need to work to make decisions basing on a strong shared situational awareness. So information sharing and real-time data turning into relevant information for them is of crucial, of capital importance in the management of first response operation. Then we mentioned workload and fatigue management. We need to use technologies which allow to better estimate risk and consequence in operation. We need that also public institutions and first responders are able to share and trust in reported information. And then we have all the challenges linked to the organizational ergonomics. For what concerns response, we have the need to ensure that everyone can access help and support fitting specific needs. Also, we need to look at coping and not only physical health and physical well-being, but also taking care of mental well-being of affected citizens. Also because disaster consequences may be unequal among our society. In terms of institutions, we need to have to support them in designing clear, feasible, and accessible rules for the temporary shelters, for the access of the support of the health. They need to be assisted also in their physical and mental well-being. We need to support, thanks to human factors and user-centered design, the design of logistic chains which fit the needs of everyone. We need also to set temporary relocation fitting needs of everyone. And then also incorporate bottom-up social initiatives and citizens willing to contribute in the response services. Then we have the next step. Next step after a disaster are considered the key step to building back better. And then we need to allow citizens to being heard, to expressing needs, to consider everyone equal in asking specific characteristics of what will come next. And then we can rely on participatory design applied by institutions. Of course, we need to learn from disasters. We need to design infrastructures which from the beginning are suitable to cope with everyday use, let's say a sport facility, which will be used as temporary shelter in an accessible and equal way once a disaster happens. And finally, we have also the prevention and mitigation, where we see all the same principle, let's say, and where the key role, I would say, is played by safety culture, which needs to be possibly developed in both citizens and institutions. Is this, let's say, utopia or something that we can bring somehow into the reality? I would like to bring you the experience of co-project, which is a New Horizon Europe project, which is the answer to a specific call asking for human factors consideration in a disaster resilient society. This project has among its 5 building blocks safety culture and human-centeredness and inclusive design as steering, let's say, pillars, scientific pillars, conceptual pillars, to assess and to design the better management of 7 disaster scenarios, ranging from earthquake, flash floods, and of course, biological pandemics, such as COVID-19. What are the human factors lens or the human factors specific activities considered by core project? We have the concept of inclusive design and vulnerability mechanisms in crisis. We have human-centered design applied to the assessment to design of emergency plans and operations to better fit needs, characteristics, and ability for all social groups. And then we have a safety culture. In this case, we framed a specific definition, a concept for safety culture for disaster resilient society. And then now we are running a measurement campaign in 5 European countries involved in the project. Just a quick example on how we manage vulnerability mechanisms, considering that vulnerability is not something fixed, but dynamic mechanisms resulting as from the combination of background of the inherent weakness, social and economic status and biases, within the human environment interaction, and within a larger organizational context of governance and technological means that we have at our disposal as both citizens and public institutions. Then we have built a taxonomy of indicators of human-centeredness, procedures and plans. Then we also, in this case, we are following 4 pillars, which are leaving no one behind, building capacity and inclusion for resilience, removing the environmental barriers to resilience, and pursuing resilient community development. All these pillars are furtherly detailed into category of indicators, and then in specific metrics to be applied in specific core project use cases. And finally, we have the safety culture perspective. In this case, we made, let's say, the jump, bringing a concept widely applied in industry, in a variety of industry. In each industry, a lot of specific tools have been designed to investigate, to measure, to assess how positive or negative may be safety culture within a company group or subgroup. And then we apply this knowledge base, let's say, to the inclusive approach of a core project, looking at a definition of safety culture which is aiming at ensuring equal opportunity of safety and equal opportunity to recover from disaster for all members of our society. Then we have the definition looking at safety culture as the pool of prevailing values, attitudes, and capabilities that within a community ensure the maximum protection of all its members before, during, and after a disaster. Then we have specific aspects of a community which is expressed by safety culture, and this is affected by common ground, transversal to all society categories, but also the variety of subculture that we may have in our social groups, looking at values, beliefs, and other personal characteristics, which affect how we perceive and we understand risks and disasters. And finally, we look at a positive safety culture, which enables a coherent and harmonized understanding of risks and severity of disasters' consequence by all members of society, not only public institutions, first responders, and civil protection, but extended to any member of our society. Then, based on these principles, we have designed a toolkit to support a safety culture measurement campaign with 3 tools, namely a survey, an interview, and workshop templates, looking at 3 target groups, which are citizens, first responders, and public institutions. And we are right now running this measurement campaign. And by the end of the project in August 24, we will have also a picture of commonalities and differences in safety cultures among our European regions. So we have a very dense bunch of concepts, of opportunities, and I'm open for questions. I know that maybe we are a little bit late, so I give to Dennis the decision on how to go on.
Yes, I think we should allow a few questions because this is indeed a very rich topic which touches everyone. So I'm sorry to all the Nordic people in the call, but I think we'll make an exception and delay the program a few minutes to allow for questions. Please. So I have a question related to these final aspects that you presented, Gabriella. I noticed that there are a few European regions in this core project. Could you say something about the partners that are collaborating with you?
Okay, we have, let's say, we have a few regions because this activity is very demanding, so we cannot have a larger geographical coverage, but we have a good representation of all European regions because we have Sweden, we have France, we have UK, okay, almost European region, and then we have Italy and we have Germany. This allows us to really understand how cultural, social differences may affect risk perception, risk preparedness, and then also what can be the hook that we may rely on as designers to make all these steps I mentioned for disaster resilient society working better. So I guess that even if we don't have all the 27 countries represented, we have a good idea of how European society may differ in terms of safety, relations with the risks and relations with the safety. And this will open, I guess, good idea, good suggestions on how to better manage also at overall European level this disaster resilient society mechanisms, because we are looking at really diverse societies.
Thank you, and I'll stop the recording to encourage other questions here. Thank you.